Councilmember Trayon White. Councilmember White, thanks for being with us.
Thanks for having me.
Appreciate that. Well, you had a vote last week in City Council on UMC, and my normal co-host, this guy's, Peter's relatively normal, but is a guy you probably know well, Ed Smith.
Yes, absolutely.
And yeah, let's get you right on mic there.
Check.
I know Ed spent a lot of time with you guys last Tuesday, and his nurses there. Very concerned about what's happening with UMC. Can you fill us in on what's going on?
Yeah, so UMC is a hospital owned by the district, and historically over the years we had a number of operators operating the hospital. We went from Veritas to Mazar, who was the new operator, and it's been on the decline. Actually, the building is what we call functional obsolescence, meaning it's just getting too old to keep putting more and more money into a building that's declining. And so we've tried to dump money into the building to keep the building operating, because we know that our still residents, especially senior citizens who use that location as a hospital and for services on a daily basis. And so there's been some new proposals on the table to take money out of the hospital, and to make the board use $15 million to zero the budget out to make that work by July. And so there's some concerns that we won't be able to function at maximum capacity with decreasing the budget from the proposed mayoral budget of $40 million to now cut by Councilmember Gray to $15 million. And we're trying to figure out what number actually works for the hospital. So there's some of the debate that's going on right now at the council.
Mm-hmm. Yeah, and put this into context, because we just came through this battle over Providence, and and it's just like honestly, I don't know that we've talked about a whole lot else except DC hospitals for the last couple of years, and I'm thinking, man, if I'm living in DC, I don't want to get sick.
Yeah, so Ward 8 and Ward 7 is home to residents with the highest health disparities in Washington DC, from diabetes to birth rates. As we know, the obstetric unit got closed, United Medical Center, also Providence, also, you name it, we have it. And so it's not just something that the community wants, but it's something the community needs, in the community. So with the proposed budget now as it is, with only $15 million, there's going to be significant cuts in services over at the hospital. And residents are concerned. I'm getting emails from the nurses to the doctors to the patients about, are we setting the hospital up for even deeper failure? And are we planning on sending residents there for real care? Or are we just, with the plan is just close it? And so what I see is that we have to figure this out. And we're leaning on the health committee, which is ran by Councilmember Gray and also Chairman Minister, to figure out this budget with a push and nudge for me how to keep it functional with real people in there every day. And the numbers have been said as about under 80 people currently at the hospital, but we're not taking into account the amount of people that are using the emergency room as their primary care facility, or just to go get checkups. We know that's been a number, even though it's not right for people to do, but that's what's happening every day in the hospital currently.
Yeah, I saw that came out after the vote last week, that there was this number that was being promoted about only 80 folks, and it's oh geez, it's only 80 folks, and it's not that big a loss. But I'm hearing the same thing you're hearing, which is that's actually a really deceptive number. And I think what I'm wondering about is the ripple effect, right? I mean, there's not only the direct effect as you're talking about in the community, right? But then as these different hospitals around the city, and they are in very specific communities, let's be clear about that, those folks, and I'm hearing these stories, I'm sure you are, about these other hospitals that are now being overwhelmed as folks are having to go over there.
So I hear that now currently at UMC and at Howard University and other local hospitals, that they have to take on the brunt of people coming who normally go to these other facilities to get services coming there, when we have a lot of high number of Medicaid, Medicare patients. And so they have to take those patients. So we are, and then you have to think that if doctors or nurses that are working there don't have confidence their job is going to be secure next year, they're going to think about somewhere they can work that's more secure, and maybe be abandoning ship or giving less care because they feel like we're not valuing them as workers and defunding the hospital. And so we have to take that into account as well.
And you're raising a really good point, Hassan, because we saw this at Providence. Remember, at Providence, because this went on for over a year, And I remember hearing from the folks at 1199 and national nurses. And you can think about it, right? You know, as the rumors were going around, people start looking for other jobs, and so then it becomes a self-fulfilling prophecy. People look for other jobs, they leave, and then the hospital says, "Oh, you know, we're losing folks," and it sort of justifies that. Well, Councilmember, White, he's out there in the district, and it sounds like he's hearing a lot of the same things that you're hearing.
So yes, I actually had the opportunity to visit the Congress Heights Wellness Center last week to honor a few of the elders there. But their concern is that they have to travel longer, and the concern also is that they have to access Metro Access or Seabury to get to their doctor's appointments. And when those are not coordinated, or when they have to reschedule, it takes them longer to get to their doctor. And who knows what type of needs they have, and they have to get dressed right away so when they get an appointment. And if their doctors are going to be leaving or have appointment time schedules, have to travel farther to get to their doctor, which leads to poor health conditions and leads to more, neglect from the city as far as making sure they have what they need, especially for those residents who have paved the way for a lot of us, like myself as a young man, African American, growing up in Washington, D.C., to have some opportunities I have because they have paved the way for me. So we have to do our due diligence with a $15.5 billion budget to ensure that we can have somewhere for them to go. And we don't even know when the new hospital is going to be built. And so that's the other issue, because there's so many legalities about what's next for the new hospital, and it's smaller. And we're fighting with trying to figure out what to do to address the trauma issues concerning residents in Ward 7 and 8 with not having a level 1 trauma center there. So there's a lot of things that haven't been worked out from the tower issue with GW University. And we don't. It's a lot of uncertainty with the next hospital to try to shut down the hospital that's currently there now.
Let me just reintroduce everybody. We've got in studio with us Councilmember Trayon White from the 8th Ward. Hassan Kanu is a legal editor and reporter at Bloomberg Law. I'm Chris Garlock, and Peter Pocock sitting in for Ed Smith, who's on the line with us from the community. And yes, Peter's reminding me that you can call in at 202-588-9739 or 1-800-222-9739. This is to support the kind of voices that you're hearing now. Ed Smith, you're really, you and a lot of the other folks have just been out there, beating the bushes for the last couple of weeks on this issue. And I know it's sort of, as you were saying, red alert. How are things going out there?
Yep. Shout out to T.O.B., Chris, and Jimmy Jenkins. I saw that. Yeah, so I have my staff right now trying to find $10 million in the budget. But of course, we're going to need the help of the chairman, who has the final stamp from the council side on the budget, because as you know, it's a balanced budget at this point, and so when you take from somewhere, it's real tricky.
I want to ask you about that. I mean,
Yeah.
and you and Ed, thanks for calling in. Good luck out there, man.
Thanks, Ed.
Yep. But my colleague David DeZenio really well.
Yes.
Obviously, he's our political director, and one of the things that he said when he was reporting on this at our council meeting, this is Metro Council as
Gotcha.
opposed to your DC Council. We
Yeah.
have a lot of councils here in DC. And what he was saying was that what happened was that money got all parceled out.
Yes.
And so now, our folks are in this, kind of uncomfortable position of, trying to take money.
Yeah.
And there's a lot of, from folks who also deserve the money.
Yeah. So I saw that. So when we tried to scrub through the budget to figure out where the $25 million went, it was one of the pots that I seen it went into was to do prostitution reduction in Ward 7. I was like, whoa, that's not, we talk about building a health healthcare system in the ward, I would have been happier if we used that money to build a comprehensive healthcare system in Ward 7 and 8. But it kind of went into special projects. But some of those are good projects.
Of course.
And so we have identified now around 5 million, but we're trying to get to at least 10 by tomorrow. And we're looking for help. I know Councilmember Kenny McDuffie talked about helping out. Alyssa Silverman has gotten into the fight, and so there are other members who are chiming in on this very critical issue.
And you're kind of up against the deadline here, right? I mean, you got another vote on Tuesday, so there's a time certain, right?
Yes, absolutely. And then you have to get it, certified with the CFO and make sure it's legally and technically sufficient, and a lot of that stuff got to come back right.
I'm so glad you're doing this. It's just makes my head spin.
I know that Councilmember Gray is in his legacy years, and he's done a lot for the city, and we support that. It's just about how it happens, and we don't want to leave innocent people to go astray or to die. This is life and death for a lot of people.
Is that what's
in
going to
addition
take? It's going to take some people dying?
Well, it's happening. We've seen some. We've had 4 shootings in Ward 8 last night. We had a fatality on MLK and Talbot yesterday. And so we're talking about some critical issues facing residents every day right now in the city. We had a few shootings this weekend. And so we're anticipating that we have to move fast and move with, responsibility, that we as council members and also as the mayor have responsibilities to the residents to ensure that we can provide a quality healthcare system east of Anacostia River where the needs are the greatest. It's hard to keep saying that, from the diabetes to the high blood pressure, hypertension, we have it in the ward, and highest trauma victims.
Yeah, absolutely. I think that.
Well, we're running out of time, but I just know that didn't directly come from Councilmember Gray. That came from Universal Health Services that's partnered with GW University that said they're not going to waive the exclusivity to let other universities practice at the hospital. And I beg to differ. I just left Howard University and spoke to Dr. Frederick, and I just know that there are doctors who had the opportunity to go to Harvard University. They went to Howard University because they want to work in a community that looks and reflects them as far as Black and people of color. And so we're trying to ensure that happens or create some type of partnership or agreement with Howard, because Howard is getting a lot of residents that most people won't take. And then people complain about Howard, but they don't know the backdrop of what Howard has to go through on a daily basis to serve the number of population they're getting, and most people don't have private insurance. UHS is the partnership that has GW. They want to build a new hospital east of the Anacostia River. And they're making the point that if Howard is part of the deal, they will not move forward.
Gotcha.
Because their agreement is that they have an exclusive relationship with GW to allow their doctors to practice.
Gotcha.
And we're saying that we have a stake in the game. Well, I'm saying that we have a stake in the game to play too, because we've put almost $300 million into this deal as well as a city. And so this is not just something private that you are doing on the side. This is include us as well. And so, the executive branch, is more specifically Rashad Young, who's city administrator, is negotiating the deal. And so I'm trying to push them to make sure we have a comprehensive strategy to allow Howard University to allow their doctors to practice there in a predominantly African-American community, where Howard University produce more doctors of color than anywhere in the United States of America.
Mm-hmm. And UHS, by the way, as we've talked many, many times on this show, just happens to be totally anti-union. Anything else that folks need to know in advance of the vote on Tuesday?
Yeah, just say that just beyond this hospital, we're really fighting for a more equitable budget. There's been a number of conversations about the racial inequities in Washington, D.C., especially talking about gentrification in the city. And we have to do more to ensure that we address the health issues as well as education, housing inequities. And we're not doing enough. I'm going to say it. I look at the budget. This is my part. We're not doing enough to address the inequities, especially racial inequities around housing, healthcare, education. In fact, Ward 8, right, experienced a $10.4 million cut in its budget for DC public schools.
Wow.
That's a sin and a crime.
Mm-hmm.
And at the time we have $1 billion extra in the budget. So we're fighting beyond just a new hospital, but to make sure and Councilmember Grosso and the chairman have got the budget up to a 3% increase in a uniform per pupil student funding. But we have to do more to ensure that we give our students a chance at a healthy living here in Washington, D.C.
And